I now recognize myself for the purpose of making an opening statement. This is our second hearing regarding pandemic-era school closures. We're investigating the decision-making process behind school closures and the effects it had so that we can do better in the future. Inherently, part of that investigation is evaluating if the Centers for Disease Control and Prevention followed science as they knew it or learned it, or merely accepted outside guidance regardless of available data during its guidance drafting and publication process. This is part of the reason that we're here today, to determine to what extent the opinions and suggested guidelines offered by, in this case, the American Federation of Teachers during the CDC guidance process were accepted and why they were accepted. Americans are curious to know if the AFT access was in line with CDC past practice and if their influence had a positive or detrimental impact on America's children. While it's reasonable for the CDC to seek outside opinions, were some opinions accepted and others not considered, and why or why not? These are questions that we need to ask. To be clear, we are not here to attack teachers, the teaching profession, or suggest pandemic-era teaching was easy, because it was not, and we all know that. We are here to conduct an after-action report, establish lessons learned, so that we can better protect our children in the future and protect our children's futures. During this process, honesty is non-negotiable, and the facts should be facts, not political statements. Beginning in March 2020, in response to COVID-19, schools around the world began to close. Doctors and scientists didn't know a lot about the novel virus, and decisions were made based on whatever facts were known, and at the time, they were what was known to try and best save lives. However, it became clear, in fact essential, long before the beginning of the fall of 2020 semester, that schools needed to be, and safely could be, open for in-person instruction. It was happening. My children have benefited greatly in every way, academically, physically, and mentally, from their schools being open since the fall of 2020. And when the facts become clear, our decisions must change with them. It's important for students, important for parents, and important for teachers. Further, the facts and science supported the ability to safely reopen. While children could get and transmit COVID-19, it was rare. While children could die from COVID-19, that risk has been estimated as 1 in a million. Some estimates stated that children actually became 10 times as likely to die by suicide, a crisis exacerbated by school closures. And with a wide range of mitigation strategies, COVID-19 transmission in a school setting was low. Schools could have and should have reopened. And again, many did. The baseline question should have been, schools need to be open. Are we doing everything we can to make that happen? Unfortunately, many schools chose not to reopen, despite the science supporting safe in-person school practices. This all came to a head in February 2021 when the Biden administration and the CDC issued its first school reopening guidance entitled The Operational Strategy for K-12 Schools Through Phased Prevention. According to reports, when this guidance was issued, its recommendations would keep 90% of schools, including almost all of the 50 largest counties in the country, from fully reopening. Why? Primarily because of 3 recommendations. The use of community spread rates to determine reopening, a requirement for routine screening testing, and 6 feet of distancing instead of 3 feet. None of these based in sound science at the time, yet all directly supported by the AFT. Community spread does not reflect school spread. Data showed that it appeared safer to be in school than in the community in many, many cases. So if the goal is to get kids in school, and it's essential for America as we determine things to be essential or not, then why was the recommendation to follow the community spread data and not the in-school spread data, which is actually the environment in question. The AFT is, of course, allowed to have an opinion. I respect that. But opinion should fully explain how the opinion was reached. This is how science works and how science is debated. Teachers teach science. In an email on February 11, 2020 to Director Walensky from AFT staff, AFT takes issue with the current CDC language that stated, at any level of community transmission, all schools can provide in-person instruction. Seemingly to weaken that statement, AFT proposed adding, in the event high community transmission results from a new variant of COVID-19, a new update of these guidelines may be necessary. The CDC obliged and added that edit to the final guidance. Why not, in the event of a high in-person school transmission rather than community transmission? They're two different. In an email to the president of the AFT staff prepared a document for the president for a February 1, 2020 phone call with CDC. AFT staff wrote that the CDC should support the adoption of screening testing. In notes provided to the President Weingarten, before the same February 1, 2020 call with the CDC, AFT staff wrote, emphasize 6 feet of distancing. The guidance is fairly good on 6 feet or more of distance. It could be made stronger by rebutting directly school systems that are using lower standards to keep students in school. Let me say that again. Basically, AFT objected to schools using less than 6 feet of social distancing so that kids could return to school. AFT's support for these unscientific mitigation policies calls into question why it was offering scientific advice to the CDC in the first place. The scientific expertise of the AFT is called into question, and also called into question is the high level of access and influence the AFT was provided by the CDC. In the AFT letter to this subcommittee on April 19th, lawyers wrote, quote, releasing guidance on how to safely reopen schools without attempting to address the concerns of these educators would not only be irresponsible, but also futile, end quote. The lawyers continue, in short, the failure to consult would have been foolish and self-defeating, end quote. To me, these statements sound like a form of intimidation. Is this more political than scientific? Of course, in the letter and prepared statement that President Weingarten submitted today, she mentioned former President Trump 12 times. As best that I can tell, President Trump had nothing to do with the crafting of AFT guideline recommendations. That's the topic today. The purpose of this committee is to examine the procedures followed, the decisions made and why, what motivated decisions, and what worked and didn't work. Then ultimately, I would hope that we can produce a product, bipartisan, that will guide future generations so that we may have the ability to predict the next pandemic, prepare for it, protect us from it, and maybe even prevent it. And in this case, maybe even be able to successfully maximize our children's education, especially in-person education, not just for some of our children, but rather all of our children across this country. I pray that today's hearing will produce some of the necessary facts and evidence that this subcommittee may utilize going forward in order to achieve our altruistic goals. I would now like to recognize Ranking Member Ruiz for the purpose of making an opening